Hello friends, welcome back to my channel. In this video we are going to discuss MCQs on Pharmacology 1 Unit 1 General Pharmacology, which is Introduction to Pharmacology and Pharmacokinetics. So let's begin. The question is dash is the study of drug and its action. The answer is pharmacology. The next question is a drug is said to be an dash if it does not produce any biological response even on binding with the receptor, but in its place it either blocks or decreases the effect of an agonist. So the answer is antagonist. The next question is dash involves the study of utilization of drug and its effects. The answer is pharmacoepidemiology. The next question is dash is the ratio between the dose that can produce useful and the dose responsible for side or toxic effects. The answer is therapeutic index. The next question is dash is the habitual use of psychoactive drug that results due to repeated and continuous use of these drugs, and an abrupt discontinuation of drug may result to withdrawal syndromes. The answer is addiction. The next question is sometimes some disease can be induced unknowingly by medical professionals when they prescribe drugs for some other underlying disease. Such diseases are known as iatrogenic diseases. The next question is the branch of clinical pharmacology is specialized for conduction of clinical trials and conduction of research studies, so both A and B. The next question is pharmacology is derived from Greek word pharmakon, which means drug, and logos, which means studied in. Question is dash is the part of pharmacoepidemiology that involves the study of pharmacokinetic and pharmacodynamic features of the drug which is already present in the market. The answer is pharmacovigilance. The next question is dash are macromolecules present on the cell surface which the drug molecules bind and cause modulation of their function. The answer is receptor. The next question is dash of a drug is the ability of it to bind to its receptor. The answer is affinity. The next question is dash is the measurement of effects generated by therapeutic agents. The answer is effectiveness. Next question is dash is the path by which a drug is introduced into the body. The answer is route of drug administration. The next question is dash is the safest and most economical and convenient route of drug administration. The answer is eternal route. The next question is the main advantage of dash route are the patient is able to self-administer drug and chances of systemic infection are reduced. The answer is oral. The next question is which one is an advantage of oral route of administration? The answer is it is economical. Sterilization is not required. The next question is which one is the disadvantage of oral administration? Drug could not be administered during emesis is a disadvantage of oral route. The question is in dash the drug is kept within the mouth under the cheeks or buccal cavity where it is disintegrated and absorbed. Correct answer is buccal route. The next question is which one is an advantage of buccal route of administration? Portal circulation is bypassed. The question is the drug is administered in the form of suppositories through dash when patient is not able to take drug orally or have restrictions on eating. The answer is rectal route. The next question is which one is an disadvantage of rectal route of administration? It is irregular absorption. The next question is dash shows rapid effect and maintains level of drug in circulation. The answer is parenteral route. The next question is which one is a disadvantage of parenteral route of administration? The answer is repeated injections not suitable. The next question is in dash route of administration aqueous preparation get absorbed rapidly. The answer is intramuscular. The next question is which one is a disadvantage of intramuscular route of administration? The answer is only 10 ml of drug can be administered. Risk associated with IV route can be reduced by using subcutaneous route. The next question is which one is an advantage of subcutaneous route of administration? It is complete but slow absorption. The next question is systemic side effects related to drug can be minimized in dash route? The answer is inhalation. The next question is, by the dash route of administration, local to systemic effects can be obtained. The answer is topical. The next question is, a substance or product that is used for the purpose of diagnosis, prevention, relief of cure of disease in man and animal is known as drug. Next question is, dash are drugs that activate the receptor but they show similarity with natural hormone or transmitter. The answer is agonist. The next question is, dash is stated as the father of medicine and mainly anatomy and physiology form the basis of his writing. The answer is Hippocrates. The next question is, the concept of all cells from cells was advocated by Virchow, a German physiologist, in 1855. The next question is, the father of experimental medicine is Claude Bernard. The next question, who is the father of Indian pharmacology? So the answer is Sir Ramnath Chopra. The next question is, drugs that have harmful effects on body are known as toxins. The next question is, dash are greasy in nature and do not evaporate. These oils are mainly glycerides of palmitic, oleic and stearic acids. The answer is volatile oils. The next question is, dash are sugar-free derivatives of catechol. The answer is pyrocatechol tannins. The next question is, dash are obtained by fractional distillation of petroleum. The answer is mineral oils. The next question is, what is source of insulin? Animals. The next question is, which one drug is obtained from mineral source? The answer is Rajgray. The next question is, dash is an opioid and opiate antagonist used in patients already weaned off opiates to prevent a return to these drugs. The answer is naltrexone. The next question is, dash is a state in which an individual is influenced or affected by a drug or other toxic substance. The answer is detoxification. The next question is, dash is a group of signs and symptoms which appear in physically dependent individuals when the use of drug is stopped. Withdrawal syndrome occurs when continuous administration of a drug with a specific dose for a long time mostly results in reduced response to the drug. The answer is tolerance. The next question is, dash tolerance is measured within the duration of action of single dose or the first few doses of a drug. The answer is acute. The next question is, when the individual administering repeated dose of a drug experiences biochemical changes, it is known as physical dependence. The next question is, dash occurs when the cell receptors undergo transient saturation with the drug. The answer is tachyphylaxis. The next question is, dash relates to the effects when given dose of drug is administered more regularly or chronically. The answer is protracted. The next question is, in dash the drug combines with a body protein such as the body fails to recognize the protein and treats it as foreign protein, thus forming IgG or IgM antibodies. It is type 2 reaction. The next question is, which reaction is also known as autoallergy? So the answer is type 2 reaction. Any drug is studied under its absorption, distribution, metabolism and excretion. The next question is, dash is defined as the extent of absorption of the drug, availability of drug at receptor sites and the therapeutic effectiveness of the preparation. The answer is bioavailability. The next question is, dash is also known as the corpuscular or vesicular transport because cell membrane engulfs extracellular material by forming a vesicle or saccule which is destructed by the enzyme present within the cells and lysosomes later on. The answer is endocytosis. The next question is, dash is carrier mediated transport system that works with faster rate than simple passive diffusion. The answer is facilitated diffusion. The next question is, effectors affecting drug absorption, R, pH of the GIT. The next question is duration of action of drug is dashed by plasma protein binding of the drugs. The answer is increased. The next question is dash is defined as hypothetical volume of body fluid into which a drug is dissolved or distributed. The answer is apparent volume of distribution. The next question is factor affecting the drug distribution are drug interaction, obesity, disease state. So all of the above. Question is dash is the main site of metabolism for most drugs. The answer is liver. The next question is a specific group of dash enzymes involved in liver's primary mechanism for metabolizing drugs. Cytochrome P450. The next question is which of the following factor is not responsible for affecting the drug metabolism? The answer is humidity. The next question is dash are responsible for the excretion of nearly all drugs as well as their metabolites due to certain extent. The answer is kidney. The next question is the dash pressure of blood flowing in the capillaries act as the driving force for filtration by the glomerulus. The answer is hydrostatic. The next question is dash is a carrier mediated process. The answer is active tubular secretion. The next question is gastrointestinal excretion is a non-renal excretion. The next question is dash hypothesis also regulates the excretion of drugs through skin via sweat. The answer is pH partition. The next question is dash is a non-selective process which occurs in one direction only. The answer is glomerular filtration. The next question is the rate at which a drug is excreted by the kidney into urine comparative to the plasma drug concentration is known as the drug renal clearance. Question is drug movement involves kinetic energy of molecules, so any other source of energy is not required and the process is known as passive diffusion. The next question is absorbed dose before reaching the blood circulation is reduced by transformation in liver by first pass metabolism. The next question is usually in empty stomach absorption is maximum. The next question is solubility of a drug in lipids is dash proportional to its urinary excretion inversely. The next question is a drug that possesses a large volume of distribution show dash excretion in urine. The answer is poor. The next question is methyl transferase is involved in dash of the drug metabolism. The answer is phase 2. The next question is who gave the fluid mosaic model? Answer is S.J. Singler and G.L. Nicholson. The next question is port transport is also known as filtration. The next question is if chemical energy like adenosine triphosphate is utilized in movement of substance against its concentration gradient, then it is known as primary active transport. Question is which site is known as diazepam binding site in human serum? Albumin binding site 2. The next question is dash globulin is also known as transcortin alpha 1. Next question is which globulin binds to carotenoids? Beta 2. The next question is which site is known as digitoxin binding site in human serum? Albumin binding site 3. Next question is through dash and hydrostatic pressure drug pass blood capillary membrane. Passive diffusion. The next question is dash's layer is formed by extension of such tenticular cells that surround the seminiferous tubule. The answer is blood testis barrier. The next question is dash is the enzyme system that cause oxidation of the drug. Various components make up the enzyme system. Mixed function of oxidase. The next question is dash is the complete removal of drug in a specified time period from hypothetical volume of body fluids containing the drug. The answer is clearance. The last question for this video is upon administering drug repeatedly at short intervals, it gets accumulated in the body until elimination balances input and attain a steady state plasma concentration. For now, thank you.